Hello, everyone, and welcome to another awesome episode of Nurse Converse, brought to you by Nurse.org. My name is Jeri Ford, and I'm so excited and honored to be co-hosting yet another awesome, jam-packed episode full of information that I definitely feel all of you will find very relatable. So if you listened to my first episode with Nurse Converse, you remember we talked about dating and relationships and nurses, and that got a lot of wonderful feedback. A lot of conversations were going based off of that episode. We talked about all the complexities that come along with that and being both healthcare and trying to date or trying to be in a relationship. If you haven't taken a listen, you definitely don't want to miss it, so go back and listen to that. Within that episode, there were many, many points that hit home with so many people that I got messages from. But one stood out way more than the others, and that was the topic of vicarious trauma and the way that that related to so many people. So that's what brought us here today. Although myself and other nurses are experts in experiencing vicarious trauma, but I am no expert by any means on how to handle it. So I brought in the same lovely guest from the last episode, Danielle Palomares. Danielle, can you give us another little intro about yourself?
Hi, Jeri. Yes, and I'm so excited to be here. I am a trauma, attachment, and sex therapist based in Pasadena, California. I specialize in all three of those subspecialties, and I work a lot with healthcare providers.
That's amazing. And that's actually the reason I found you in the first place, is because I was looking for someone who did both relationships, could help with that, and with healthcare workers. Yeah. And I know you're passionate about helping us and helping us deal with all the things the complexities that go into that. So I'm so excited to have you back.
Yeah, thank you for having me. And this is such an important topic.
And by the way, a little side note, I had a lot of responses from the last episode, but I also had so many people respond in my messages and my friends saying that they loved the sound of your voice and that they feel like you could solve all of their life problems. And I thought that was
my gosh. That is so funny. I blame it on my mic.
Yeah. Well, my mic's not doing that, so it's definitely something special about you for sure. So before we dive in, I want to read a quote from a book that you recommended on that last episode and to me personally in our side chats called Trauma Stewardship by Laura Vandernoot Lipsky. Hope I got that correct. I'm about halfway through the book. It's wild how much it resonates, but the first chapter was this quote that I had to put my book down and just let it marinate for a second because it was so good. So here's the quote. She said, "After so many years of hearing stories of abuse, death, tragic accidents, witnessing death and unhappiness, of seeing photos of crime scenes, missing children, deported loved ones, in other words, of bearing witness to others' suffering, I finally came to understand that my exposure to other people's trauma had changed me on a fundamental level. I had absorbed and accumulated trauma to the point that it had become a part of me and my view of the world had changed." Yeah. I mean, I read that and I was like, oh my, that was the first chapter. I'm like, oh, okay.
Really?
I'm sure you being a therapist, that can relate to you too. And I'm like, I think that just this overall topic of what that means to bear witness to someone's pain every single day as a part of your career, how that does affect you long-term. I think it resonated with so many people. That's why I'm so excited to delve into this.
Yeah. And it's a great quote to start.
Yeah, it's definitely highlighted and starred in my book right now. So,
yeah.
So I guess first and foremost, what is vicarious trauma for anyone listening that has no idea what we're talking about?
Yeah. So vicarious trauma, it goes by several different names. We might hear it referred to slightly differently. Some people call it secondary trauma exposure responses. Also, empathetic drain or compassion fatigue are some other ways we might hear about it. And it's effectively the impact of bearing witness to other people's trauma and pain and hurt, right? We are mammals designed with mirror neurons to feel alongside other humans. And so when we do that over and over and over, and especially as part of our jobs, it has an impact. And stop.
Yeah, it definitely does. And I think that that's something not really, it's talked about that nurses are burnt out, and it's talked about that, different things like that, or that it's stressful or emotionally taxing. But I think like putting a label on it like that and really defining it like that, you're like, oh my gosh, yes, something we all experience.
Right. Well, and I think one of the hard things, and I do think there's value in naming this before we dive in, is that this is a difficult topic for healthcare providers to sit with. It is uncomfortable, I'll be honest, because most of the folks that show up in my office, there is some amount of protective distancing, minimizing. This can't happen to me. Oh no, I'm acclimatized to my job. It doesn't bother me to see people die day after day after day after day, or, and there's a good reason why people come in with these narratives. And to be frank, maybe there are some people that are just completely unaffected. But most of the time, there are these impacts, and to admit them can feel very vulnerable. So I just want to name that and invite whoever's listening to maybe just be curious about how you're feeling as you listen to this podcast and what's coming up on the inside as you hear these ideas.
And I think probably once we get into next, this like the symptoms or what it looks like, I think maybe that could switch people's perspective a little bit too, and be like, to be honest, when I read the book or started to, I thought maybe, I kind of deal with it pretty well. And then, first chapter, first thing, I'm like, whoa, okay, never mind. I guess I'll be reading this a little more intensely. So yeah, I think that just this is a good episode for us healthcare workers for sure. So I guess that we'll go into sort of what it looks like. How do nurses know what it looks like, or if they're experiencing it, or signs and symptoms?
Yeah. So to borrow from the author of the book, she says this really great quote, basically that we have a trauma exposure response, it's universal. This is a universal experience. So also taking away some of that shame and stigma, there are a lot of different ways that this can manifest. There's physical and cognitive and emotional symptoms. So interestingly, a lot of the healthcare providers that come to me, they start to talk about more of the physical pieces. It's this idea that like the body will rest you if you don't rest it or if you don't honor it. So a lot of chronic fatigue, a lot of like feeling kind of perpetually buzzy and on edge and unable to actually relax once your shift is over. Increased susceptibility to illnesses is a big one. Maybe changes in appetite. I see your face there.
Well, I realized once I started this new job and started the I think night shift was a part of it too, but now that I think about it, I'm like, yeah, I've definitely gotten like sick a lot more than I had before, working in the ICU compared to other times. So I'm like, that's interesting for sure.
Totally. Yeah. And then, it is hard, right? Like to tease out like what is causing which. So we have to look holistically at what someone is bringing in. And we'll talk perhaps later about also how other types of trauma that a nurse might be experiencing, things like racial trauma, things like coming in with complex trauma from childhood, right? Attachment trauma, that will only compound, what that they're experiencing in terms of vicarious trauma. But there's also cognitive symptoms. Some of the really big ones I see, especially from nurses, are dissociative moments and derealization. This can be really scary for nurses to admit, right? Because the thought of you not being locked in during your shift and kind of floating through and not being present is scary to admit out loud. But so many nurses that sit in front of me tell me, Danielle, I have no memory even of like even being on my shift. I was on autopilot the entire time, completely out of body.
Yeah.
And that happens.
I've never like sat and thought about that. And I am like thinking of a handful of times, 100% that I was just there, which is good. And that means we're good at our jobs, I guess. But
yeah.
Not making mistakes and still being there, but not even really fully being in the moment, just trying to separate. I've definitely done that.
For sure. And then there's hypervigilance. Minimizing is a really big one. So minimizing your own experience or the experiences of your patients. Sometimes binary thinking can come up. So really starting to notice that we're having some struggles with embracing complexity and nuance. That's a really big one. And then a lot of deliberate avoidance. This isn't exhaustive, but just kind of listing off some of these core symptoms that I tend to see more in nurses too. A lot of deliberate avoidance.
I know another thing that they mentioned in the book too that is definitely within, I think, these symptoms too, is she gave an example of she was on a hike with, I believe, her dad.
Yeah.
And she was standing on a cliff and it was like in a foreign country, and she started getting anxious because she realized I'm on a cliff in a foreign country. I don't know what their healthcare system is like. If something happens to one of us, where will we go? And I didn't even realize that could be a symptom of this vicarious trauma, because I have done that. So I travel so much and I love it, but I have anxiety that I don't even speak out loud sometimes about if I am somewhere remote or I am somewhere else. Where do we go if a medical emergency happens? If one of my friends has something happen or I have something happen. I went on a foreign trip with my mom, and I was so anxious about that because she's the person I love the most. Yeah. And I'm like, if something happens, where do I take her? And I'm like, that's crazy to think that's probably, I mean, I'm sure some people have that anxieties too, but I think that's definitely a direct impact of seeing all of the things that we see as nurses and healthcare workers in general.
Totally. And I think also in that passage, if I remember correctly, she also brings up this existential piece alongside those worries and anxieties, which we could categorize as like hypervigilance, right? Like kind of always being on guard and like waiting for the next danger, the next issue to kind of emerge. But that she was staring off the cliff and she started to like wonder about how many people had taken their own lives, right? Like this existential piece, constantly thinking about death, constantly thinking about, this greater existential tug. And it's really hard, right? It steals the moments away from us, because she also named that she was supposed to, sort of everybody was standing around taking in like, wow, the wonder, the awe of this beautiful space. And she was thinking about death.
Yeah.
Right.
Yeah.
So
yeah, that's it's crazy. And I think that is a good example of when you can kind of realize and check in with yourself and just be like, this is maybe something I need to work on or figure out, because it's not healthy to, I guess, live like that or just keep going and think that it's just going to get better, or you can just push it away maybe.
Totally. Yeah. We could file that too under like rumination. That's a big one. So a lot of healthcare workers tell me that they really struggle when their shift is over, when their service block is done, to not constantly check charts and to see about patient outcomes, and to then think about the stories of the patients over and over and over again and ruminate. Yeah. And I'm clocking
guilty.
Your expression.
Guilty. I'm so guilty. We have a lot of us nurses that try to check in with each other and be like, how is so-and-so doing? And it's like, I know. And I'm like, wow, I call them my babies, even though they're not my babies, but that's what I call them. I'm like, after work, I'm like, I wonder how my baby's doing.
Well, it's like partly it's like how human of you, Jeri, right, that you do care, right? And but then we can also appreciate it's like a tightrope. It's like finding this balance so that it's not, tidal waving our actual personal life outside of work. And that's hard. It's hard to find that balance.
Right. I know you were saying, I was thinking of some of the other symptoms, and I know behavioral too, like you were saying, withdrawing from others and friendships. And I guess,
yes,
I know that happens a lot too, as far as like in relationships and things like that, which I think we're going to get into a little bit later. But I didn't know any other signs or symptoms within that category that you could touch on a little bit.
I mean, I do a lot of nurses, understandably, especially those that maybe, do per diem or have back-to-back or don't take many days off. They talk to me about how they get off work and they don't want to socialize. They don't want to be around any of their friends. They're tapped out.
Yes.
And so that's really tricky. And I certainly hard relate as someone that has a very big caseload myself of therapy patients, that you get off and you've given so much energy to others, to other humans. So we'll talk more about this, but the importance of learning containment, learning how to fill your own cup back up, but then also being deliberate in engaging in community, because too much withdrawal can actually be sapping in its own way.
Yeah, I almost feel like me, and it's partly my personality. I'm just very extroverted, but I almost feel like I go the opposite way. I'm like, I almost feel like when I'm sitting alone and then I have to think about it. So I'd rather just be bopping all over the place, which sometimes I need to learn to say no, but yeah, I think that's probably part of it too.
Yeah.
So we have these moments, and I can think of a specific moment just recently. Obviously, I've been a nurse for going on 13 years. So the amount of these moments where I've had that just feel surreal are endless. But this more specifically, I remember somewhat recently, I for those that don't remember, I'm the pediatric ICU nurse. And there was a kiddo that came in, a very tragic, and I don't want to say too much, but it was a very tragic incident. You know, this kiddo didn't make it. She was 6, and it was a tragic accident. You know, something that was, she was completely fine that morning. The accident happened. And then, of course, not fine, and she did not make it, and it was on our shift. And I just remember, you know, I didn't have that patient, but I was next door. Yeah. And my patient the parents had not spent the night. So it was just my little kiddo sleeping by herself. And I remember hearing the cries of the mom next door, and me, myself, had to go into my other patient's room and cry. And I'm like, oh my gosh. So I guess my question is, or to help myself, of course, and all the other people listening in the moment, what can we do to protect ourselves? Or even like balance between letting it out, but also, I guess I don't know what I'm trying to say, but letting it out, but also not damaging ourselves further in that moment, because that was hard. I had to like step away and go into my other patient's room and cry. Luckily it was a baby, so she didn't know what was going on. But so yeah.
Well, yeah, I mean, so great question. And I just want to also like pit stop briefly to just honor like what you're sharing. And I can see as you touch on this story, even in this moment, I can see the ways that, you know, it's pulling up just emotionally for you, and your empathy and your sense of connection to that pain that parent must have been, you know, just slammed with, right? I mean, I can see it even right now. And I just want to stop there and say like, how human of you.
I know. I know. And it's funny too. In fact, thinking about this podcast too, I always try to think of what my personal triggers are, and some things I'm able to sort of bypass where others aren't. But when it's like, I've learned about myself, like a crying mom and something that tragic is the one that, I just like, I just can't do it. Well, I can, I got through it, but I'm like, oh my gosh, how do we do it in the moment? What are we supposed to do when we realize something like this is happening?
Well, I mean, so a couple things. And I have a lot of thoughts swirling. I'll try my best to organize it, because I'm also aware of like the systemic pressures to keep everything zipped up. Right. And that to be fair, you know, I'm speaking from a position as a therapist, right? So my lens is going to look different than a nurse. And what I would say is that there is a practice here. It is longitudinal, and cultivating these skills takes time. I want to just start with that. Like, I wish we could throw some quick fixes, but the truth is that there is a practice here. I really love, specific to this situation, being present can be very helpful. Being present with your own experience, being present with the feelings that you're hearing coming from the other room, but also being present as you went into that other room. There, you mentioned there was another child there. So being able to then switch and be with her or you know, that child, that to me is one of the big tenets. We have to find ways to be present, which means we are going to be shifting moment to moment and allowing ourselves to move into the next place. The other piece to this is an idea of pendulation. And as a therapist, this is like my number one skill. I need to be truly empathetic. I need to be able to feel what my clients are feeling. Otherwise, the therapy feels vapid. You know, I'm closed off. I'm stealing. I'm doing a performance. I need to be with it. But I also am here as a professional to provide containment, attunement, and safety. And it is not safe for myself or my patient if I am flooded. So there's this pendulation. There's this beautiful dance of learning how to straddle what we call like the limbic system, the feeling parts of the brain, maybe more of that right hemisphere, but also keeping that prefrontal cortex and the left part of the brain. It's almost like there's this taut balance. And if we allow ourselves to get hijacked in either direction, we risk numbing and being kind of too closed off and too zipped off and performative and not really empathetic. Or we risk flooding and getting dysregulated. And so this is an art, all this to say. And it's okay if anyone listening struggles with this, because it's hard.
Yeah, because you want to balance. I mean, as a therapist, I've seen the difference when I've gone to a therapist who I can tell is not really like there. You can feel it, so I understand what. Yeah, you can definitely tell a difference, and I feel like the same with nurses. I don't want to be a a nurse that a family can tell is checked out or somewhere
Right.
else. I want to be there. That's why I'm doing this. But
For
yeah,
sure.
at the same time, I don't want to have it take a toll on me also,
For sure.
or more than it does.
Yeah. And so one of the things too is, and the book talks more about this idea of like developing stress resistance, becoming a
Mhm.
stress resistant person. And that involves several other things. I don't know if we should get into it now or later, but things
Yeah,
like
let's
cultivating a
do it.
sense of agency, um, you know, creating meaningful tasks outside, meaningful things that spark joy outside of the workplace. Like there's a lot of
Mhm.
things we can start doing to build out a world that allows us to be a bit more resistant.
Mhm. Yeah, I think we could get into that for sure, like the
Hmm.
stress resistance and more like skills on that. Because I know they talk about, I was going to ask a little bit too about burnout, and I feel like that's kind of um, the same tips is to make sure your outside life is you have things going there too that can help, I guess, balance the work part of it too.
Yeah, for sure. So some of the
Yeah.
things that I really work with a lot of my clients with is, of course, and I always say this like kind of with a smile because I've had many clients joke with me like, my last therapist told me to go outside and look at the sun, and like, so I also don't want to make a sound, like we hear the same things over and over, and I can understand some of these sound kind of trite, but there's truth in it. We have
Mhm.
to look at healthy habits and lifestyle choices, which includes
Mhm.
getting hard exercise, or joyful movement, if whatever feels good in your body, but moving the body, really taking a curious stance at the use of stimulants and substances in your
Mhm.
life because they can have a massive impact. And then really thinking critically about how we are resting. I think so many people think that doom scrolling and binging social media for hours and Netflix shows is restful, but the truth is when we start to critically look at those things, oftentimes they're actually more dysregulating.
Mhm.
So thinking
Guilty.
about right.
Very
um
guilty on that.
I mean,
Especially the doom scrolling. Oh my gosh. I'm like, the amount of times I would fall asleep after a shift with like my phone on my face from
oh yeah,
and TikTok like still running. I'm like,
yeah.
oh my God, I gotta like reel it back.
Yeah, it's numbing behaviors in a
Yep.
way. And there can be joyous parts of TikTok, and like you go on to see a cat video, but all of a sudden you're hit with something deeply disturbing, right?
Yes.
So it can
Yeah.
hijack you from that. So there's also, I work with a lot of my clients too on like how to harness social media, how to create algorithms that support their like wellness. So anyway, another podcast for another day,
You're
but
right.
but things like this, being really thoughtful and mindful as you look at your life. There's also this piece of community support and social
Mhm.
resourcing. I do think that finding a way to connect with people that you care about and that care about you is so important. We can't heal in isolation. So there's that
Mhm.
piece as well.
Yeah, and I just want to throw out there too. I hear a couple times, and I know you have listed here like community support and being social. And I've heard a lot of times a lot of nurses just be like, I just don't love hanging out with other nurses outside of work. And
Mhm.
I understand that. I also feel that I almost feel the opposite. And I guess it's whatever works for you. I can't imagine having gotten through my career and through the hard moments without having a circle of other nurses
Yeah.
or without having someone to talk to. We are the only ones who know exactly what we're going through. So I can't even imagine. I feel like fostering, it doesn't have to be the same people even on your unit if you don't want it to be, if you want to keep that
Right.
balance or whatever you want to do. Just, I was a travel nurse for 10 years, and I feel like my group of travel nurses, my core, I wouldn't have gotten through this without them. I can't even imagine. Or my nursing school girls, I just can't. So I feel like
For sure.
having that support group is of the only someone else who understands is crucial.
Oh, yeah. Yeah. And I think, again, speaking to this idea of balance, having a balance of connections, having colleagues that get it is so important, as well as having friends that can introduce new stimuli, like new ideas and thoughts, right, that
Yes.
aren't in the field. So I think it's also just being mindful and cultivating a well-rounded support system and network is important. But our society is so individualistic, and it really makes it difficult because a lot of these issues are relational, and we need other people to help in part of our healing journey. We need to be in community with others. It's vital.
Definitely.
And one other piece, Jeri, that I think is worth naming in this section is learning how, and this is a hard one, and I think you might see in our notes, I underlined it, I bolded, I made it really big. But it's this idea of developing a greater capacity to experience the full range of human emotions. And this one's really sticky because
that's deep. Yeah.
Yeah, because in our families of origin, our culture, the hospital systems we may be in, or the workplace environments, there are a lot of implicit messages that we learn about emotions, that there are some that are off limits. There are some that make us weak. There are some that make us bad even, or that are dangerous to experience. But the challenge is when we selectively try to repress and disown certain emotional experiences, we then are robbing ourselves of joy, of presence, of love, of connection, of all the other emotional experiences that are really important too. We can't just selectively numb. And so I think this is the big piece that I work with most of my clients on, is emotional assembly, is learning how to tolerate and really feel and be with certain emotional experiences.
Yeah. And I feel like a lot of nurses are scared that if they feel that too much in the moment, then they'll just the waterworks will go.
Yes.
So it's probably, and same for me. I feel like, I had to step away in that example, but in the moment sometimes too, and I'm just pushing it back. I'm like, oh, if I let myself feel right now, I'm going to be feeling.
Right. And totally. And to put an asterisk on this, I think it sounds like you were very intuitive and wise in how to handle that specific situation. Like you knew, if you can feel that feeling where I'm going to go over the edge and it's going to hijack my body.
Yes.
So in therapy, we do this work very slowly. As a trauma therapist, especially, we're going to move very slowly into this.
Right. Do you feel, so this is something that I really, really wish that nursing school, if this is talking about such a slow process, I really wish with all of my heart that this is something they touched on in nursing school. Do you feel like that could be valuable of teaching? I don't remember learning about how to take care of ourselves emotionally in nursing school at all. Then again, I went 15 years ago, but yeah, I feel like there could be some value in that for sure. And maybe, I don't know, generations are changing, so maybe Gen Z could work on that for us, because I feel like that's so important.
Yeah. I mean, I don't think that this is, for what it's worth, I don't think this is just nurses. I do think that there are, just culturally, we're taught so many messages about, disowning certain emotional experiences, mental health. There's so much stigma, but I think things are turning. I think I'm noticing a huge cultural shift, which is exciting.
Okay. Well, maybe we can work on that for sure. So if you need to we'll skip on a little bit and just talk about when you're experiencing it, but you still need to be, we talked about sort of in the moment and at work, but when you just need to be a productive person or get things done, do you have where can we start as far as figuring that out once we're feeling these things?
Yeah. So, I mean, for anybody that's listening, especially those who are new to the field, I would just say, number one, it's prevention, right? It's this adage of once you're already thirsty, it's likely a sign you're dehydrated. It's very similar. If you're already noticing some of these symptoms, that's a cue that we got to start addressing this and not kicking it down. Because the challenge is if we keep pushing it off, it will eventually get to you. It can cause breakdowns. You're going to have to take a leave, and so we want to avoid that. If you're already noticing symptoms, I would really strongly suggest, if you have the capacity, if you have the resources, to seek support, to get actual support from a therapist in learning some of these more nuanced skills, because our jobs are nuanced, right? We have to cultivate a certain skill set that you named is not taught in nursing school. Aside from that, the biggest thing would be starting to try to make the unconscious conscious, developing intentionality in our day-to-day behaviors and our movements, and really learning how to self-attune and how to develop self-awareness. Those are kind of the core pillars of the work. And this can be done on your own. I just think that it's more effective when we have someone to support us in it.
Yeah, absolutely.
Yeah.
And then I'm sure it's like hard too for like, because everybody, I think you mentioned too, everyone's just a little bit so different in what these, so I feel like that's where it's valuable in working with someone individually, because they can get to learn you and get to learn how you respond and how you cope and what would be good for you, because everyone's just so different.
Right. And so like, for example, the book talks a lot about developing mindfulness, and which is so important, and developing the capacity to be present. But the challenge with kind of just slapping that as a quick tip and trick is, as a trauma therapist, I am well aware that if a person has spent the better part of their lifetime detaching from their body, detaching from their emotional world, and all of a sudden they're being told, okay, go and sit still for 10 minutes in a guided visualization, go breathe, go feel your body, it can actually be really dysregulating.
Yeah.
So it is important for us to take an inventory before we start trying to address vicarious trauma, and knowing where we're at. How much can we tolerate? Are we able to get into some breath work? Can we sit with certain emotional experiences? Are we too numbed out, or are we too dysregulated, or are we oscillating between those two things? Is that making sense? So there's a nuance to this, figuring out what you need.
Right. Which is why I feel like it is so important to see somebody, for us healthcare workers to see somebody, so they can get to learn us, because we don't know ourselves as well as I feel like we think we do sometimes. So it'd be nice for another person to help us with that, for sure. So I guess that sort of gets into a little bit like the unhealthy ways that we cope. We talked a little bit about what to do in the moment, or what we should be doing. And we talked a little bit about like doom scrolling and other things like that. But what are ways that you see, where we tend to see in healthcare workers specifically, of like unhealthy ways or things that we shouldn't be doing?
Yes. I would say the number one thing that I see is hyper intellectualization.
When I saw that in the notes, I'm like, that probably sounds like something I do, but let's talk about it.
So it is interesting. And I think it's important. This is a good place to clarify that there's different kinds of therapeutic work. I've had a lot of healthcare providers that have come to me and they said, I've been in therapy for 10 years. I know all of the different, I know every cycle. I'm aware of everything that's going on. I can see, I've analyzed everything. Here's my dissertation on my inner world. But they haven't actually done somatic work. They haven't been feeling in therapy. They've been hiding out in their prefrontal cortex, so to speak, right? Or like their left brain. And that is a huge, huge protective mechanism. Like, I'm actually not accessing the emotion. I'm talking about it in a very intellectualizing way.
Yes, I've been guilty of that for sure. I've been guilty of that with this, but also in like regards to like dating or relationships and things like that too. Just like staying right here instead of like feeling it.
Yeah, for sure.
Guilty.
Yeah.
Yeah.
And then we also have minimization comes up, denial and normalization. Some of the most common things I hear from nurses are, a disowning of the word trauma. Like, I see trauma every day. I can't be traumatized. Like, other people had it way worse than me. Other people have it way worse than me. So there's this like feeling of not feeling enabled to or entitled to own that word and own the impacts of what you're going through. So there's that.
Yeah. Mm-hmm.
And then believing that they're immune is a really big one that I see. Nurses thinking, I'm strong enough to handle this. I have to be strong enough to handle this. It's not affecting me.
Mm-hmm.
I'm somehow a magical mammal that is not impacted by by other people's trauma. So I think that that's a big one. And then, of course, we already talked about a lot of substance use, alcohol use, avoidance, oversleeping during times off, not moving, certain things, doom scrolling. So a lot of those kind of, maladaptive sort of, or I guess you could say they're adaptive coping techniques, but that they're not really serving serving the real aim, which is to feel well.
There's even like TikToks, like it's a TikTok trend there for a while. Like at least on nursing TikTok, I saw like, nurses during shifts, and it's like boom, boom, us being like, the cool, great people that we are. And then it was like nurses on their day off, and it's just like, nurse like passed out with like popcorn on her chest and like the TV on.
Precisely.
And I'm like, it's just so true. Like, or couch rotting, I feel like is what they're calling it, which I'm like, oh my gosh.
Yes.
Yeah, it's just a normal thing, which I guess isn't, it could be worse, but also it feels like we need to sort of like sit with it a little bit more.
Yeah. And I mean, I think the fact that the couch rotting, it does make sense to me. That's telling me my physical body, I need physical rest. I need emotional, spiritual rest. But I would just say that thinking really intentionally about what the options are in terms of that, because I think that many of us can relate that on those days that we rot, we don't always feel rested after. We feel more lethargic. We feel worse.
Yeah, I feel like that happens to me quite a bit, which means it happens to other people too. If I really do spend that time, sometimes I'm like, that's exactly what I needed, but most of the time it's not. Most of the time when I actually make a conscious effort to, on my days off in between or something, I have a scheduled plan already, at least a Pilates class or at least a dinner with a friend.
That's great.
Something like that. I feel so much better, even though in the moment I feel like I'm not going to have enough energy for this, or I just can't, like my mind is but I just make myself go, knowing that afterwards I feel much better.
Yeah, that's great, Jeri. Exactly.
Yeah, I'm trying, but that took years. That took a long time for me to realize that, this is a balance. And
and then there's also this, I don't know if you've ever experienced this. I know I certainly have when I lose track of certain practices, but then there can be this feeling of you've been on go, 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 go. And then when you have a moment to stop, it's almost like your nervous system's on fire. And when you sit still, it's really uncomfortable.
Yes.
So that's the other side of this coin, right?
Yes.
It can be really hard to go full, like it's almost like when you're running on a treadmill and then you stop suddenly and then you get off the treadmill and you still feel like that weird wah feeling as you're walking off of it, It's the same thing for your nervous system in terms of being on like, especially depending on what kind of shifts you do and like how much, like how long your work blocks are. Oh my gosh, so hard to rest on the tail end of that.
Yeah, I'm queen guilty of that. I feel like more than anything we've said so far, I'm queen guilty of that. I mean, even as far as planning trips, like I'll plan work, leave for Vegas, work, leave for Europe. Like I just have things planned constantly. And I feel like that's part of it. When I actually do sit down, then I'm thinking about it.
Yeah. Yeah. So figuring out wind down with clients like that, I really work on creating wind down routines and containment routines so that we can slowly titrate back towards a place of rest,
Yeah, I actually love that. A wind down routine. I could use that probably.
Yeah.
Or at least like some kind of next day off, something that kind of gets me a little bit more like I'm here, my day off type thing.
Yeah.
Okay, I got some ideas floating around now. Maybe a couple friends that I should probably send this episode to, because we're all the same as far as that. Yeah. I mean, even my friend that lives by me, she's one of my nurse friends I met traveling. She laughs. She's like, I don't know anybody that go like you. And I'm like, it's probably a coping mechanism of somehow, but sure, let's just keep going.
Yeah.
So anyway, that's definitely me. As far as like, speaking of like relationships and other people and things like that, how do you see, kind of to piggyback off of our last episode as well, do you see the vicarious trauma? Well, I'm sure you do. That's how we got on this topic of affecting relationships, whether it's friendships or people we're in a relationship with or dating. Yeah.
Well, so I do a ton of couples work. I would say half my practice is with couples and different kinds of partnerships. And so when and a lot of couples work with one partner being a healthcare provider, if not both. And, one of the challenges that I often hear couples talk about is like, it's hard to be intimate with a moving target. I don't know if we talked about this in our last episode. Okay. No. It is hard to be intimate with a moving target. So if you have two type A, like very high achieving people in a partnership that are go, 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 especially two healthcare providers, it can be really tough to be in stillness together, to catch each other. It can also be hard if one person is a provider and the other's not. They have more space perhaps and more of a bandwidth, and you don't. And then there's this feeling of, being pawed at by your partner when you get off work, and they want to connect, they want to be with you. And it can feel really engulfing, especially on the heels of our jobs. And so, again, this takes a lot of intentionality. We have to work on creating internal and external boundaries with our jobs and creating mindfulness. The wind down routine can be helpful so that when we get off of a shift, we have a period of time where we're transitioning from that one type of stance into our personal life, so that when we're in the personal life, we're in it. Is that making sense?
Yeah, definitely.
Yeah.
I feel like it also takes, finding a perfectly supportive partner, or at least someone who's understanding. I feel like that, if they're not also in the healthcare world too.
Right.
Yes. And prioritizing yourself, I imagine too, or being able to, I think that's something us nurses have a hard time doing too, is assertively not really standing up for, but just assertively expressing what we need. Because I know sometimes in partners I've had in the past, they don't necessarily know. And if I don't know what to tell them, then that's both of us not really knowing what we need. And so that's,
right.
That's both of us being lost of what to do. So that's not helpful. So I think both understanding yourself and what you need, and then being able to express it, from at least my past relationships, is what comes to mind as far as how to deal with that, for sure.
Yeah, that's a beautiful point. This idea of cultivating that self-attunement so that you can assemble your world and then ask your partner, because they're not mind readers, and we all have different nervous systems, different needs, different bodies. And so being able to resource your partner and say, I really need this in this moment I'm feeling, and then hopefully having a partner that is able to attune to you.
Right. Yeah. And being able to find that time to just focus on them too.
Yeah. Staying present is the one that I think we had bolded in our notes.
Yeah. Yes. Oh, yes. I know. That's hard. That's hard to do. I actually can't really even imagine working with someone else in healthcare and trying to balance that too. So props to everyone doing that.
Yeah. It's a lot.
Another question I know I had when I reached out to, actually a friend brought this question up when I told them we were going to be doing an episode on this. They said, how can we balance maintaining relationships with our patients? It's going back a little bit.
Yeah.
But maintaining relationships with the patients, but not taking on their trauma. It's just a little bit more touching on that.
This is a great question.
Yeah.
So a couple thoughts that came up when we talked about this is, number one, I always have to go back to focusing on what my role is, specifically at work, right? What is my role? How can I best support my patient's needs? Because it's not about me, right? It is about, I'm there to be a container. I'm there to, serve my patient. So that's the first thing. Go back to the role. I would say trying not to get lost in the plot of the details and the content, versus finding a way to emotionally attune to your patients, right? Because I think it can be easy for us to, for example, let's just say that you were supporting that family, right? We don't want to get too lost in all of the traumatic details of the event and what they're going through and the story and I think if we can just hone in on what they're emotionally feeling. There's so much grief here. Mm-hmm. I hear you. I feel you. I'm with you in it. I see you. And I'm also in my role. I'm going to try to give you the best care possible. Mm-hmm. As opposed to letting your mind start ruminating about all of the traumatic pieces and the details and the stories. I'm not sure if that's landing, but I find for myself as a therapist, this is it distills the moment so that we can be more present.
No, I think that's good to keep in mind because, an example is, there's been parents we've had that they are not only in the hospital, but they're having other issues too. They don't have a job. They're trying to find housing. And I find myself sometimes thinking of ideas for them.
Yeah.
And I'm like, that is not my role. So it's definitely landing. I know exactly what you're saying. Just trying to really separate. That's not what I'm here for. I can lead them to the resources that we have. That is my role.
For
but
sure.
finding it out for them is not my role. So I've had to do that a lot too.
Yes. And that's also part of the boundary setting, creating some really good boundaries internally with yourself.
Yes.
And then back
Absolutely.
to this idea of the pendulation again, finding a way to access your emotional world, so that you can tap into empathy and connection with your patients, but also staying connected to that front part of the brain. And honestly, this is a great place to just weave in a little bit of the therapeutic piece of, I'm really a big fan of parts work. I know we talked about this in the last episode, but, in one of the therapy modalities, internal family systems or IFS, they talk about this idea of self energy. And this is a hit or miss concept, but we could also replace self energy with like my wise self, my higher self, my grounded, regulated self. And when we are in our roles as providers, we have to find a way to stay tethered to our self energy, to be that container for our patients. And then when we get off work, finding ways to attune to ourselves, to what came up on the floor, to what happened on the inside, right? But that us doing that processing in the moment with the patient is not ideal, because then we can get dysregulated.
So then maybe, something, tell me if I'm understanding, just like if while we're at work, we can feel these emotions, we can go through, we can just focus on being there and then focus on us the second you step out, and just sort of trying to balance it that way.
Yeah.
Which sounds a lot easier. Like when you say it like that, it's like, oh, duh, hard. But it's not that easy in the moment. There's just like, you're at home thinking about work and you're at work thinking about home or thinking about them or whatever. So
Yes. So I constantly am checking in with myself as a therapist in sessions. I'm like, am I in my self energy right now for my clients? Or I sometimes say my wise self. Is my wise self in the room? Or is my hypervigilant manager who wants to solve my patient's problems and who's coming in and wants to do everything and wants to overwork her, is she here? And if I start noticing her creeping in, I have her back off. Am I in my self energy, or do I feel this part of myself that is getting activated and triggered because I felt this feeling before? And I start to, and we can use this part, this empathy part, and say, I see you. Let's use this to connect with our patient in a real way. But we are not going to let this part, the emotional, sometimes these feel like our little children, or the parts of ourselves that are more raw. We're not going to let that part come and take the helm and be like, okay, I'm here. And then like flood.
Right.
Does that make sense? I'm always trying to think about being in self energy. And then to answer the last part, when I leave the job, I might notice those days that like younger child part, the emotional part of myself, she needs some time, because what we just saw on the job was a lot. And so then I'm intentional to care for her outside of the job in a deeper way.
Right.
Does that make sense?
Yeah, definitely. I'm trying to think of ways like when that happens, like that night where I had to, the one we use as the example, like when you come back and you're back the next night though, or back the next day.
Yes.
It's almost like, where do you even find the time for yourself to recover from that in between when you have to just get up and go the next day?
Yeah. Well, so again, I think hearkening back to the longitudinal nature, like this is a practice. I could imagine just what I would likely do in a moment similar to that. What I do is I feel that part coming up. I say, I see you. I see how triggering this is. This, like, I talk to myself. I talk to that part that feels the pain, the empathy that my patient's feeling. I see you. I feel you. You have more to tell me outside of the job. Right now, I'm going to honor you. I feel you, but I'm not going to allow you to take over my body and the system, because I have a role to do for my patient. But it allows me to tap into, again, that pendulation, that right amount of feeling, so that I can be empathetic.
I love that. I think I need to start doing that too. I would be more mindful of it. I mean, some nights are just a good night at work and you don't really have to think about it too much. And then some of them hit you by storm. And so you have to really take more. But, again, like I've been a nurse for 13 years, and this is something still I'm working on. I still see nurses of 20, 30 years still working on it. Just doesn't, I agree with you that it's longitudinal. And I do think that, I hope that a lot of young nurses are hearing this too,
Yeah.
and that they know that it's something to start. A lot of the young nurses worked during COVID, so they didn't even get a chance to build any of these
Right.
supportive tools or strategies at all, or
So
even to
hard.
learn what works for them, because they were just absolutely thrown into it. So I think, I hope this episode has resonated with a lot of people. We've talked about a lot of wonderful things today. I guess, to just sort of wrap it up, if there's a couple things that you can say, if they just remember these couple things or these 2 to 3 things from the episode, and they can only remember these things, what would you want that to be?
Yeah. So I would say bring out your curious parts and start being really curious. Be curious about your reactions to this podcast. Be curious about what your body is experiencing right now. Be curious about, the thoughts and the emotions and how you're showing up in your world. So start with curiosity that's non-judgmental, and then start developing more awareness, like self-awareness of your lived experience. Like that's the number one step, before we decide then what we need to address or what we have to sort of weave in.
Okay,
Yeah.
perfect. And then I think it would be too, just thinking of things that work for you.
Yeah.
Thinking of things that work for you, like rest, or what that looks like for you, or things that make you happy outside of work.
Developing kind of like a holistic care plan, if you will, for yourself.
Right. And I also would highly recommend anybody, I know you recommended it the last time too, the book, the trauma stewardship book, if this has resonated with any of you at all.
Yeah.
I definitely agree. And I'm so glad that you told me about it and you told our listeners about it last time too, because I'm halfway through it and I like it a lot. I love it. And it's been very helpful.
Good.
Yeah. So I hope this episode resonated with all of you the way it did with me, and this topic in general. And I hope you learned something helpful. Danielle, thank you so much once again for your amazing insight and your help. You're making such a difference between the last episode and this episode and every nurse listening to this. So we really appreciate that. Where can they find you if they want to talk more to you?
Thank you, Jeri. So they can find me at my website, DaniellePalomares.com. I'm also on Instagram, Danielle Palomares MFT. And yeah, I'm so appreciative that you asked me to come back on again. And it's such an honor. And I have so much respect and appreciation for what you do, what you all do in this field. It's a really noble path and a hard one. And I see you all in it.
We do. Thank you. And then I am Jeri Ford, and you can find me at JeriLynn_89 on Instagram. You can also find other ways to contact me on the Nurse.org website on my little page on there. And please take a moment to rate this podcast if you haven't, or write a review, leave a comment if you love this episode and if it resonated with you. And take care, everybody, and take care of yourself. Thank you. And thank you again, Danielle.
Thank you, Jeri.